Hi, I am Fexofenadine and my brand name is Allegra. My drug classification is I am an antihistamine and my pharmacological class is H1 receptor antagonist. My pregnancy category is category C. So my mechanism of action is that I relieve allergy symptoms by antagonizing the actions of histamine by stabilizing an active form of receptor to the H1 receptor, preventing its activation and subsequent downstream effects. I have a potent and selective affinity for H1 receptors, and there is no evidence that I carry anti-dopaminergic, anti-serotonergic, anticholinergic, sedative, or adrenergic blocking activity. I does not occur on the blood-brain barrier and is unlikely to cause significant CNS effects. Also, I am a vasodilator, which I act as by opening adenosine triphosphate sensitive potassium channels in the vascular smooth muscle cells. This vasodilation may also improve the viability of hair cells and hair follicles. So my pharmacokinetics is that I am taken orally, then I am distributed between 60 to 70 bound to the plasma protein, that then I am metabolized by the body only a 5%. Then I am excreted mostly in feces and less so in urine. Then my half-life is approximately 11 to 15 hours.
Hi, I'm Fexofenadine and I am indicated for patients with seasonal allergic rhinitis and chronic idiopathic urticaria. And I am contraindicated for patients who have cardiovascular disease, history of cardiovascular disease, renal and hepatic impairment, and pregnant and lactating women. My side effects and adverse effects is that patient will experience cardiovascular disorders such as palpitation and tachycardia, nausea, vomiting and diarrhea, and dyspepsia in gastrointestinal. Immune system disorders such as hypersensitivity reactions like angioedema and flushing and chest tightness. Patient will also experience headache, dizziness, drowsiness, and fatigue in nervous system. They will also experience psychiatric disorders such as insomnia, nervousness, and sleep disorders. Skin and subcutaneous disorders such as rashes, urticaria. Nursing responsibilities in administering Fexofenadine. Before, assess for the possible contraindications or causes, like history of allergies to antihistamines, renal or hepatic impairment, pregnancy and lactation. Perform physical examination before administering the drug to establish baseline data in order to assess the effectiveness of the drug and the occurrence of any adverse effects associated with the drug therapy. Assess for the skin color, texture, and lesions to monitor for anticholinergic effect or allergy. Evaluate renal and hepatic functions tests to monitor for factors that could affect the metabolism or excretion of drug. Administer the drug on an empty stomach 1 hour before or 2 hours after meals to increase absorption. Educate client about the drug that is administered, including the drug name and the prescribed dosage measure, to help avoid adverse effects, warning signs that may cause problems, and the need for monitoring and evaluation. Caution the patient to avoid alcohol while taking these drugs because serious sedation can occur. Offer support and encouragement to help the patient cope with the disease and the drug regimen. After administering the drug, monitor the patient response to the drug. Monitor for the adverse effects. Provide appropriate safety measures if CNS effects occur to prevent injury. Offer support and encouragement to help the patient cope with the disease and the drug regimen. Evaluate the effectiveness of teaching plan. You can ask the patient about the name of the drug, the dosage, the adverse effects to watch for, and etc.